Thank you for inviting me and giving me the chance to talk a bit about our work here in the region of Agder. And also thanks to the other speakers today for contributing with so much interesting knowledge and experience. During 2020, we came several steps closer to our goal of a sustainable model for digital home spanning in our region and the VOPD project was really an important contribution to our journey. So thank you, VOPD and also PR Consulting for the valuable insights and contribution to our project. A bit about the reality in the Norwegian, well, especially the Norwegian picture. So I want to take a few slides to illustrate the realities we are facing going forward. And even if this is known for the most of you, it's important because it tells so much about why this conference and VOPD and all the work going on in this field is so important. In 2030, we will, for the first time, have more elderly than youngsters in Norway, and our yearly income from oil will radically decrease in the next decades. This is a good thing for our climate, but at the same time, a big challenge for our business model. We have to make a major shift and find other ways to create value to be able to maintain our strong welfare system. A couple of months ago, the Norwegian government published a report called Long-Term Perspectives on the Norwegian Economy. And here we also find some facts that are somewhat alarming. These estimates imply that health and care sector will seize 31% of the labor years in 2060 against 13% today. And this increasingly demand within healthcare is one of the biggest challenges going forward. At the same time, we're in the middle of a digital revolution that will continue to change our lives so many ways in the years to come. This is an interesting picture from St. Peter's Square showing how different things looked in 2005 when Pope Benedict was chosen, from the New World of 2013 when Pope Francis was chosen. And we all know what happened in 2020. So, working in the field of eHealth in collaboration with different municipalities, hospitals, general practitioners, I meet different approaches, different cultures, strategies related to this challenge we're facing. And in my opinion, the most important thing is not where you take the first step, it's actually taking that step. We need more research and studies in this area going forward to navigate better in this landscape, but at the same time, organizations can't sit on the fence and wait. You don't have to wait until you see the whole staircase before you take the first step. And even if we here in Agder still have a long way to go, and I see more and more organizations actually taking its important first step, implementing digital solutions as part of their value proposition and service models. And the COVID pandemic has ushered in a new era of telehealth for patient care, and maybe also created the important push and momentum we needed to gain more speed in implementing telehealth in our value proposition service models. Now, I'm going to share a bit more about our work within this field in Agder. Agder is in the southern part of Norway, also called the Palm Coast, where kind of all the summer tourists come to in the summertime. And the Agder region consists of 25 municipalities and in total 300,000 citizens. The regional coordination group of eHealth and welfare technology involves administrative as well as political decision makers. We collaborate with the University of Agder and through the South Norway European Office. This is the regional coordination and buy-in structure between 25 municipalities here in Agder. In the board of this network, we have representatives from both municipalities and hospital management. And this is a very important network structure to ensure involvement, buy-in, and implementation in the field of eHealth. Here's a list of some of the related projects in the field of telehealth in Agder at the moment. In telehealth, or digital home follow-up as it's used in Norway, we have several years of experience in Agder. We are now participating in the National Welfare Technology Program until the end of 2021. As a result of our work with telehealth regarding COVID-19 patients, we're part of DPAR project together with the University of Agder, doing research on digital infrastructure for robust and scalable patient monitoring in pandemic. Going forward, we must have better collaboration across silos and organizations and build a platform for data sharing as a bridge between the silos. And this is a challenge the project Innovation Partnership, which started up late 2020, address. The more structured data we can collect, the more opportunities we also have within, for example, AI and machine learning. And we hope that the Crane EU project, the Crane project that kicks off later this year, can take us further on that field. We also are highly involved in Axon project for comprehensive collaboration and joint electronic patient journal in the municipalities. Now I'm going to spend a couple of minutes in sharing some of our ongoing work in the field of telehealth. And by this, I mean use of app solutions, algorithms via smartphones or tablets, where patients take measurements from home and answer simple questions about their state of health. Due to our established network and close collaboration between hospitals, municipalities, general practitioners, and tech supplier, we managed in 4 weeks last spring to develop a separate algorithm and an application for digital home follow-up for COVID-19 positive. And our experience from this COVID-19 pathway is described in an experience report published by the Directors of Health. And some of the patient stories you also heard earlier on this conference today. We currently have several ongoing pathways within digital home spanning in Agder region. Most of them are still project-based and trials from different service providers, but they all give valuable knowledge and contribute to the continuous development in the area of telehealth. Some pathways are initiated and conducted by primary care, some by the hospital, and some in collaboration between primary and specialist healthcare across the silos. And as you can see in this slide, we're getting experience from different patient groups, both from somatics and psychiatry. In the next months, we also will pilot digital home spanning from 3 general practitioners' offices, where general practitioners will initiate the follow-up and also conduct the follow-up by themselves, so we can get more knowledge from this distance spanning from a general practitioner's perspective. Here's an example from our cross-silo pilots conducted the last couple of months, where COPD patients is included and receives training in digital home follow-up from the hospital, and then hospital nurse conduct the follow-up the first couple of weeks after the patient has been discharged, and then seamlessly transferred to the municipal follow-up from our regional telemedicine center. An experience report from these pilots will be published on our website within the next few weeks, and we will continue to get more experience in these months to come. And I think also this is one of the fields that's really exciting with the cross-silo pathways. This is here's a recent user case from one of our more rural municipalities in Agder, and it's a good example of where digital home spanning can exchange other services with major benefits for both patient, municipality, and tech supplier. And we can see here both major financial and also qualitative gains. And for me, it's important to emphasize that we need to see benefits for all 3 parties to succeed with service innovation, both for the patient, for the municipality, hospital, and also for the tech supplier to have a sustainable service model. The VOPD project was an important contribution in decision process in Agder in 2020. So we are now closer to a sustainable business model. We have better insight and overview regarding our stakeholders. We have better structure and also better goal focus. And one of the major steps we took last year was to make a shift from 3 telemedicine centers to 1 regional telemedicine center, and at the same time started to work on moving more of the telehealth service out into the ordinary primary health service in the municipalities as part of their service model. And now 1 regional telemedicine center can also serve all 25 municipalities in Agder while scaling on the way forward. On the way forward, municipalities, general practitioners, and hospitals need to work with common strategy and how to operationalize these strategies. And I think we still need financial push and help from the government to be able to succeed with the transition. We need changing our business model and also our service models. We also must work on improving the technology and how to collect and share data. We have to increase the competence within telehealth and the service, and perhaps especially build competence in the middle management. But perhaps the most important thing is to work on creating a strong culture for change. On the way forward, we must be able to ensure that people take more responsibility for their own health and live longer at home. Here, technology plays an important role, but it means that the health sector must work according to a more proactive model where one invests today in order to reap the benefits for tomorrow. And then both political and administrative leadership must be on board driving that transformation. And as a final thing, Machiavelli said in 1532 that there is nothing more difficult to execute, nor more dubious of success, nor more dangerous to administer than to introduce a new system of things. For he who introduces it has all those who profit from the old system as his enemies, and he has only lukewarm allies in those who might profit for the new system. And I think so many of us working with innovation and digital transformation in public sector can relate to that saying. So keep up the good work, and thank you all for taking your important steps on the way forward towards our goal for a more sustainable future. So thank you. Here's my email address.